What if one of the most powerful countries in the world just walked away from the biggest global health organization on the planet? Not threatened to leave, not considering it. But officially and completely, they pulled out. This is exactly what has now happened. The United States has formally completed its withdrawal from the World Health Organization, a decision that is already reshaping global health, international law, and the future of how pandemics may be handled worldwide. And whether you support it or oppose it, this move could change how the world responds to the next global health crisis. Here's what happened, why it matters, and what it could mean for the future. The United States has officially ended its membership in the World Health Organization, also known as the WHO. The decision was jointly announced by the U.S. Department of Health and Human Services and the U.S. Department of State, concluding a year-long withdrawal process that began in January 2025 under President Donald Trump. This means the U.S. is no longer a member of the WHO. No more formal participation, no more funding, no more U.S. personnel working inside the organization. It is one of the most dramatic shifts in global health governance in decades. For context, the United States has historically been one of the WHO's largest financial contributors and one of its most influential member states. Walking away is not just symbolic. It's structural. It changes how global health decisions are funded, coordinated, and enforced. In a joint statement, Health and Human Services Secretary Robert F. Kennedy Jr. and Secretary of State Marco Rubio laid out the government's official reasoning. According to U.S. officials, the decision was driven by three main issues. First, what they describe as the WHO's mishandling of the COVID-19 pandemic. Second, the organization's failure to implement meaningful institutional reforms after the pandemic. And third, concerns that the WHO is not sufficiently independent from political influence by certain member states. In their view, these issues collectively undermine trust in the organization's ability to act quickly, transparently, and independently during global health emergencies. A major part of the U.S. argument centers on the WHO's early response to COVID-19. U.S. officials argue that the organization delayed declaring a global public health emergency and a pandemic, and that this delay cost the world valuable time. In a fast-moving outbreak, time isn't just money, it's lives. According to U.S. authorities, that delay may have slowed early containment efforts, border controls, and emergency health preparations in multiple countries. They also criticized the WHO's early assessments regarding transmission. Officials point to what they say was the organization's slow acknowledgement of asymptomatic transmission and airborne spread, two factors that would later prove critical in how the virus moved so quickly across borders and communities. Another major issue raised by the U.S. involves the WHO's relationship with China during the early stages of the pandemic. U.S. officials accuse WHO leadership of being too accepting of China's initial reporting, even amid allegations of underreporting, delays in confirming human-to-human transmission, and restrictions on information sharing. From the U.S. perspective, this raised serious concerns about political influence within the organization. They argue that a global health body must be able to challenge powerful member states when transparency is lacking, not rely solely on official narratives during a rapidly evolving crisis. For U.S. policymakers, this was seen as a test of independence, and one they believe the WHO failed. The controversy also extends to the investigation into the origins of COVID-19. The United States objected to the WHO-led inquiry that rejected the possibility of laboratory involvement. American officials argue that China did not fully cooperate with the investigation, including refusing to release certain genetic data from early cases and limiting transparency around laboratory activities and biosafety conditions in Wuhan. From the United States legal and accountability standpoint, they believe that without full access to data and facilities, any conclusions reached were incomplete and potentially compromised. This, they argue, further damaged trust in the WHO's ability to conduct fully independent investigations. Beyond COVID-19 itself, United States officials say the bigger problem is what didn't happen afterward. According to the United States government, post-pandemic reviews failed to produce meaningful structural reforms within the WHO. They cite unresolved governance weaknesses, lack of strong accountability mechanisms, and insufficient safeguards against political pressure. In their view, this means the organization is still vulnerable to the same problems that affected its COVID-19 response, making future failures more likely. For United States leadership, that was a red line. So what does this withdrawal look like in practical terms? The United States has fully suspended funding to the WHO. All American personnel have been removed from the organization. United States global health efforts are being shifted away from WHO-led frameworks. And future coordination with the WHO will be limited strictly to technical matters needed to finalize the withdrawal process. In other words, this is not a partial break. It is a complete institutional separation. However, United States officials emphasize that this does not mean the country is stepping away from global health entirely. Instead, the administration says it will pursue a new strategy built around direct partnerships with national governments, collaboration with private sector organizations, engagement with non-governmental organizations, and partnerships with faith-based institutions. The United States says it will focus on emergency preparedness, biosecurity coordination, and health innovation, but through bilateral and multi-stakeholder arrangements rather than through the WHO. The goal, according to officials, is to align global health cooperation more closely with national security and public health protection objectives. Legal analysts say this move raises serious questions about the future of international institutions. It brings renewed attention to how treaty withdrawals work, how accountability is enforced in multilateral organizations, and how countries balance cooperation with sovereignty. Supporters of the decision argue it strengthens national control and demands higher standards from international bodies. Critics argue it could weaken global coordination and make pandemic responses more fragmented. Either way, this decision sets a precedent, and other countries will be watching closely. Whether you live in the United States, Africa, Europe, Asia, or anywhere else, this matters. Viruses don't respect borders. Pandemics don't care about politics. Global health requires cooperation, but it also requires trust, transparency, and accountability. The big question now is this: can the world coordinate effectively without the United States inside the WHO? And can alternative partnerships deliver the same level of global reach and rapid response? The answers to those questions may only become clear during the next major health crisis. This is more than just a political headline. It's a turning point in how the world may handle the next pandemic, the next outbreak, and the next global health emergency. What happens next could shape international health policy for decades. If you found this breakdown helpful, make sure to like this video, share it with someone who needs to see it, and subscribe to the channel for more in-depth coverage of global politics, international law, and world-changing decisions. Thank you for watching, and I'll see you in the next video.